Hello and welcome back to Rural Health Today. On December 29th of 2025, the Centers for Medicare and Medicaid, also known as CMS, announced how the Rural Health Transformation Program funding will be distributed to the respective states. Now, this program was created to support rural hospitals. That was the designation under H.R. 1 legislation, as it was called, that cuts funding from the National Rural Health Infrastructure. While we are grateful for the federal government's recognition of the need for rural health funding, we were disappointed by the minimal financial contribution that this program, as well as how the funding would be dispersed to the respective states. In my state, the great state of Michigan, the new rules imposed by H.R. 1 will result in $6 billion of losses over the next 10 years for hospitals. Now, with many hospitals already experiencing devastating losses, and you've heard it from me before, with the rising subsidies that we know we're going to be facing, cost of labor, the vacancy rates of labor right now, we're being threatened by the visa increases. States around the nation will need to brace to see that many hospitals and clinic doors will be closing as these cuts take effect. Now, what will happen is it will leave the communities without critical and preventative care that they need. When the opportunity arose for hospital leaders to submit their recommendations for funding to the state, and each state was given an opportunity to do that through the office of their governor. In the state of Michigan, for example, our governor chose to allow the Michigan Department of Health and Human Services to administer the application and subsequent funding. In other states, others were designated, but let's just take, for example, what happened here in Michigan. And as that came together, I was honored to lead the task force organized by the Michigan Health and Hospital Association. Now, I met with a dozen other rural health CEOs and industry experts, and we shared our pain points. We discussed what would be required to keep the doors open for our respective hospitals, for each of the institutions. What could we do? What do we need? How can we make this work? How can this be in our favor? And ultimately, we formed 5 recommendations and passed them on to the state of Michigan for review. Well, several weeks later, we had heard that Michigan had submitted its application for this funding, and they did not address any of our recommendations or include a single one of them in their application. Now, I read through the application myself when it was published online, and that's the first time that we got to see it, by the way, the same time that the public had a chance to review it. While some solid needs were definitely represented, such as technology and workforce wellness and all of the things that are important that we share across the spectrum, the application lacked concrete strategies and clear support for our rural hospitals themselves. The very encouragement that we were given by Congress to use these funds for. Following the proposed direction of the funding, it goes to the state first for forming an administrative office to distribute the funds, creates positions in that office. Then it is advanced to many non-rural partners in care as they form opportunities, and rural hospitals can then apply if and only if they're eligible. And this is done through an application process, a grant process, whatever it is, more of an administrative burden on those respective hospitals as well. So when the $6 billion loss hits, it's not going to be hit at the state level under this bureaucracy or non-rural partners. It's going to directly hit our hospitals' bottom lines. It's going to carve out the reimbursement Michigan healthcare providers need to deliver services and support to rural communities. Now, in response specifically to Michigan State's application, CMS awarded $173 million, for example. Now, that was far short of the $250 million Michigan applied for, and we thought would certainly be eligible for. In our state, which has some of the largest rural health needs, it received the 8th lowest amount of funding in the country. Now, in light of this, let's consider a few facts. Number one, Michigan has the fourth most residents who live in a rural county where either a complete or partial primary care workforce shortage exists. Number two, we are the sixth in the country for residents living in a rural county with a full or partial mental health workforce shortage area. And thirdly, 40% of rural counties within our state don't have a practicing OBGYN, definitely OB deserts, right here in the state. Now, if I were to speak on behalf of rural health care providers across our state and even the country, this is what I would say. Our mission is to bring healthcare services to families and to individuals at their most vulnerable moments. Rural communities are the heart of our nation, and sustaining them requires adequate access to healthcare. There are so many barriers that are unique to rural communities that make it difficult to thrive. And we see this consistent in communities, not just in Hillsdale County, but in the state of Michigan and in the nation. In those rural areas, food insecurity exists, lack of transportation, economic decline, isolation, poor literacy, and it goes on and on. But at nearly every point of that list, I can still truthfully claim that having a hospital makes the most positive difference. We prop up our local food pantries. We fuel the local economy. We provide jobs, places where individuals can come to receive care and not have to wait hours and hours for transportation to take them to a tertiary center hours away from their home. We listen to each patient and provide the mental health support that so many need through our behavioral health center, outpatient services that we offer as well. We guide them through the healthcare journey in the system as we personalize their care, because that's what it means to be a rural hospital. And all of that right now stands in the balance. When decisions are made at the state and, in this case, federal level, real communities are impacted down the road. I fear that we are about to see a domino effect of lost resources and definitely closing hospitals as H.R. 1 takes effect. States like Michigan do not have the funding that it needs or even requires to support rural health. Before it's too late, we have to rewrite the story. CMS needs to adjust this funding allotment to better prioritize all of the states who have needs in those rural communities. If we don't take care of our rural hospitals today, they will not exist tomorrow. So let's go back to step one and figure out what our state really needs. If you're listening today in Wyoming, what does your state need? If you're in Ohio, what is your state? It's going to look different than what the state of Michigan needs. Then we need to use that information. What is our needs assessment to leverage every available dollar to support rural health? Ladies and gentlemen, our communities are counting on it. I challenge you today to rise tall and to be a voice for rural health.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.